let me ask you, Dr. Price, then to highlight for me, since I have not the clear understanding that my friend from Georgia does of your measure, give me 5 distinct things that are different in your measure that would get us past the status quo. And in addition thereto, how many people under your measure, if it were to be the law as Obamacare is at this time, how many people would be covered and how many people would be left uncovered?
I appreciate the inquiry because H.R. 2300, which is this bill, it's called Empowering Patients First Act, we believe that patients, families, and physicians ought to be making medical decisions, not Washington, D.C. Specific answer to your question, every single American would have the financial feasibility to be able to purchase coverage that they want for themselves, not that the government forces them to buy. Every single American. Second, you got to solve the insurance challenges. Portability and pre-existing are the 2 big ones. You ought not lose your insurance if you change your job or you lose your job. That's a holdover from a bygone era. The way that we solve that is to allow every single American to own their health coverage regardless of who's paying for it. So if they change their job or they lose their job, they just take it with them. It's like a 401k plan. They plug it in wherever they end up. And then the whole problem of portability goes away. Pre-existing illnesses, you can solve that in a couple ways. The way that we solve it is to make it so that insurance works the way it's supposed to work, which is to spread the risk. Nobody ought to be priced out of the market of the purchase of insurance because of a bad diagnosis. That's an awful system, and that's what we have right now. There are about 18 million people in this country who receive their health coverage through the individual or the small group market. Those are the folks that are at risk if they have an illness for a pre-existing illness and then be priced out of the market. The way you solve that with making it so that individuals get the health coverage that they want, not that the government forces them to have, is to allow those individuals themselves to pool together, get the purchasing power of millions so that any one individual's adverse health status doesn't significantly drive up the cost for anybody. Fourth, we could save hundreds of billions of dollars in this country if we appropriately addressed lawsuit abuse. And I'm not talking about a cap on non-economic damages, which holds down malpractice rates, but it doesn't do a thing.
You were doing good until you came in my lane. Go ahead.
The practice of defensive medicine in this country wastes hundreds of billions of dollars. Gallup estimates it's about 1 out of every 4 healthcare dollars. That's $600 billion. Jackson Healthcare has done a very scientific study that estimates it's 1 out of every 3. That's $800 billion. It's a huge waste. It's what I did, it's what Jim did, it's what every single physician in this country does, so that if they're ever called into a court of law, they can look the judge and the jury in the eye honestly and say, I don't know what you wanted me to do because I did everything. When in fact everything wasn't necessary to either diagnose or to treat the patient. The president himself has said that we need to provide physicians a safe harbor. If physicians do the right thing based upon a given diagnosis or a set of symptoms, then they ought to have a safe harbor in a court of law, or at least an affirmative defense, be able to utilize that as an affirmative defense in a court of law. That's the kind of thing that will change the culture of the practice of medicine and save hundreds of billions of dollars. There are all sorts of other things, and I'll mention one more because we're losing. I don't know if you saw the article in the Wall Street Journal yesterday on the front page, physicians going away from the Medicare system, and they'll go away from the exchanges and Medicaid as well because of the onerous regulations and because of the lack of ability to care for their patients and have their costs covered. We need to make it so that physicians are able to continue to practice medicine. The guys and the gals my age, 58, 59, 60, they're looking for the exit door. They're trying to figure out how to get out. My grandfather practiced medicine until he was 94 years old. We'd like to have a system that had those folks who have that intellectual capability and desire to continue to practice. And right now we don't. We've got it so that we're forcing physicians out of the practice of medicine. We ought to make it so that they can continue to practice.
And your estimate as to how many people will be covered?
I beg your pardon?
And your estimate as to how many people will be covered?
Every single American.
That's a good thing. Reclaiming my time, I appreciate very much and agree with Mr. Woodall that information needs to be out there, and so you've had an opportunity here to explain it, and I think you do an excellent job in doing that.